Good morning, everyone, and I would like to welcome all members and guests to our special Board of Health meeting for March 26, 2024. Please take a moment and ensure that your phones are on silent, and staff in attendance, you know the drill with Microsoft Teams. With that, I would like to call the March 26, 2024 Special Board of Health meeting to order and confirm that all members are present with the exception of Councillor Michelli, but he was going to attend virtually. He's not on the line there? Okay, so all members with the exception of Councillor or Board Member Michelli are present. I'm looking for a motion to approve the agenda as presented. Board Member Van Passen, second by Board Member Huffman. All in favor? That is carried. Are there any disclosures of pecuniary interest today? Seeing none. Staff reports item 3.1, Health and Social Services 3.1.1 Annual Service Plan and Budget Submission, HSS 24013, and I'll pass it over to Syed.
Thank you and good morning, Madam Chair. So I would like to introduce Jackie Wood, Program Manager for Planning and Evaluation, to present this report. Thank you.
Thank you, Syed. Through the chair to the board, good morning. I will be presenting on report HSS-24-013, the annual service plan and budget submission. So this report is to advise the Board of Health on the submission of the annual service plan to the Ministry of Health and request that the board endorse the submission. So the ministry requires the submission of an annual service plan to accompany the request for funding for mandatory, related, and one-time programs. The purpose of the annual service plan is to communicate program plans and budgeted expenditures for any given year in fulfillment of the Ontario Public Health Standards. So there are a couple changes to the template and process for 2024 that I would like to highlight. The first being that the COVID-19 programs have now been incorporated in the immunization and the infectious and communicable diseases prevention and control standards. And secondly, that there's an opportunity to highlight and ask for additional funding for the Ontario Senior Dental Care Program based on local needs and financial predictions. So a summary of the 2024 annual service plan includes, so for base funding for mandatory programs, a Board of Health approved budget of $9,537,100. And then for the Ontario Seniors Dental Care Program, a Board of Health approved budget of $633,300 with an additional request due to increased pressures of $316,700 for a total of $950,000. So for COVID-19 programs, both the COVID-19 general and vaccine programs have been included as part of the mandatory programs that I just mentioned per the Board of Health approved initiative. And then for one-time programs, one-time funding requests for 2024 were removed from the template with the focus shifting to the merger proposals. So the ministry has since provided assurance that there will be funding available for the Public Health Inspector Practicum program for this year, and that will be in line with the funding from previous years. And lastly, I just would like to note that the annual service plan does not include programs funded by the Ministry of Children, Community and Social Services, previously approved Ministry of Health one-time funded programs, or third-party funded programs. So that concludes my summary of the report, and I'd be happy to answer any questions. Thank you.
Thank you. Are there questions from Board of Health members? Seeing none. Board Member Duthie would move the recommendation. Is there a seconder? Board Member Brunton. The recommendation reads that report HSS, just read it off the screen, 24013 be received as information, and that the Board of Health endorse the submission of the 2024 annual service plan and budget submission to the Ministry of Health, and further that the Board of Health approve the inclusion for a funding increase request of $316,700 for the Ontario Seniors Dental Program. Go ahead, Board Member Van Passen.
Thank you, Madam Chair. I just thought I should mention that the Health and Social Services Advisory Committee reviewed this report yesterday and was in full support of it. So.
Wonderful. Thanks for that context. Okay. With that, I will call the question. All in favor? That is carried. Thank you very much. Heavy agenda today. We're moving right into a confirming bylaw. I'm looking for a motion to approve bylaw 2024-3BH, moved by board member Huffman, seconded by board member Columbus. All in favor? That is carried. And I'm looking for a motion to adjourn at 11:06 PM, moved by board member Huffman, seconded by AM. Buckle up, council. Buckle up. We've got a good long day ahead of us. 11:06 AM, moved by board member Huffman, seconded by board member Duthie. All in favor? That is carried. Thank you very much. Okay. We'll be back later.